My name is Yaneer Bar-Yam. I am professor and president of the New England Complex Systems Institute and a co-founder of the World Health Network. I have 6 statements to make. 1, the evidence review of N95 respirators compared with surgical masks cited today is incorrect because it is based upon incorrect mathematical assumptions. Even though the studies admit limitations, the mathematical expressions used to evaluate uncertainty intervals is incorrect, both in their means, the results are biased toward null results, and in their range, resulting in smaller ranges than is consistent with the study data. Again, while the limitations of the RCTs are often acknowledged, the mathematics of those studies and of the meta-analyses is not corrected to account for those limitations, and thus the study conclusions are based upon the wrong analysis. The evidence review also chose studies that are subject to those errors, omitting many scientific studies whose results indicate that N95s are much better than surgical masks. We have previously published one relevant study on mask study assumptions with a title starting Unmasking the Mask Studies, and we'll submit a second study shortly, which we can provide the panel. 2, while invalid, the dismissal of the increased effectiveness of N95s by those studies does not apply to elastomeric masks or PAPRs, just as for many other measures, scientifically validated causal transmission mechanisms demonstrate their effectiveness. Thus, higher levels of protection from transmission are available and can and should be used in practice and adopted in policies. 3, where are the studies measuring impact of provider N95 respirators on patients? Absent. Also, the adverse effects. Current UK reports say over 1/4 of infected patients were infected in the healthcare setting. Their death rates are also much higher. 4, the isolation precaution guideline workgroup materials do not directly mention asymptomatic transmission and should. 5, it should be a given that protecting individuals who are vulnerable to consequences of COVID infection should be a top priority in healthcare settings whose responsibility is making people well, not sick. 6, everyone is vulnerable to organ damage from COVID. This includes, but is not limited to, long COVID symptoms. This should be mentioned. Indeed, it should be emphasized in your statements and referred to in your policy recommendations.